Hey everybody, it's Michelle. I'm going to be talking to you today about the Assure Platinum machine that we have. Going through a couple of the properties in the machine, how to clean it, how to set it up, and then how to do the control on it. So on this machine, new to what we've had in the past, it has a test strip release. So you just push this forward, slide it forward, and it pops out the strip. It's really important not to pull the strip out like we normally do, because you'll end up making it so this doesn't hold the strip any longer. So make sure you're using that just to flip it right into the trash can. On the back, you'll have the serial number. There's also a 1-800 number that you can call if you need any assistance or you're having any issues with your machine. They can talk you through it. Also, I have put the owner's manual and a couple of other things under the shared drive. If you go to the shared drive under staff development and go to FHC education folder, in there there'll be a folder on this machine with all this information in there. Cleaning it, really important that we clean it at the start of your shift, after every single resident use. This is very important. It's an OSHA guideline. Bloodborne pathogen decreases the risk of any of our residents getting a bloodborne pathogen, so make sure you're cleaning it every time correctly. You wrap it in the sanding cloth bleach wipe, which we have. It's the this one right here. It has an orange top. You can use the purple top, but if you're using it on any of our contact precaution patients, you want to use the bleach wipe. So I think it's just better to use the bleach wipe for everyone. It is under, Assure says that either one of those products is safe, but the orange top is for contact. So I think it's better, like I said, just to use the orange top for everyone so nobody ends up using the wrong one for the wrong resident. It has to stay visibly wet for 4 minutes, and then you need to allow it to dry, and then you can use it on the resident. That's why we have 2 glucometers in each of our med carts, so that you can alternate and it doesn't slow you down checking your residents for their blood sugars. On the test strips, make sure you're writing, every time you open a bottle, that you're writing the date on the top. That's really important. On here you will see, right here, the lot number and the expiration date. And then right here, you'll see level 1, which is the low control, and there are the numbers for that. And on this one is the high control, and there are the numbers for that. You want to keep these strips closed. Don't store them outside this container, and just keep the container closed and in your drawer. And then these are right here are your controls. You have a high and a low. And this is the bag it comes in. This bag right here should really be dated as well, of when you open this bag up or take or start your controls. Make sure you're dating this bag. Okay, control solution also has an expiration date on it, so look for that. It's right here. Expiration date, and then you just twirl it around and it's right there. Okay, so let's get started on setting up your machine, and then we'll do a control. So the first thing you do, it's just some basic rules for setting up your machine, is you push the M button, and this full screen layout will briefly display, followed by memory. You see the M there for the memory. Then you want to hold this button for about 2 seconds, and then you'll get an audible beep symbol that comes up and appears at the bottom. The current settings will display for each menu option as you scroll through them, and you can change them. You should really have the audible beep on or off. That really doesn't matter. whichever your preference. The hypo warning should be set to on, and I would set it at 69. So you can change that by changing one of these numbers. There you go. And then press the M. This is your daylight savings time. I just have that on the 24-hour number, which really doesn't matter. That's really your preference. And then your date and your time, set that up. And then it's ready to go. Now, when you go to do your control, your machine's going to look like, no, wait, we're not done yet. Sorry. That's your light. And this just reminds you that you need to do your check on your control. Okay, so let's turn this off. Okay, so when this machine, when you turn it on, or you stick your strip in, so you take a strip out of here, stick it in, and don't you love it when it all goes incorrectly? Okay, hang on. There we go. Okay, so it'll flash when you put your strip in, it'll flash like this. And this means it's ready for you to stick the patient with the lancet, safety lancet, and put their blood in here. When you do your control, you want to press either one of these buttons on either side. It doesn't really matter. And you'll see this little thing right here that comes up, and it says C on it. That's your control bottle. And now it's ready to do your controls. If you do a control without this and just this on, your control numbers will not match up and you think your whole machine is messed up, and it's really not. You just haven't set your control here, okay? So let's do a control for, let's see, which one is this? Oops. Okay, we'll do for normal. So you want to set just a little drop there, or you can do it on one of the plastic pill things, and then you just drop. There you go. And now it's counting down from 7 seconds. And this says 93. And then if I go to my strip bottle and look on the back here, 85 to 106. So it's in normal range, it's ready to go. That's basically it. If you have any questions, please feel free to give me a call. You can email me or stop by my office. I have put a in-service training sheets at each nurse's station, so you need to sign and date those and have another nurse, either myself, the charge nurse, just to do a quick check, a competency check on the back here. And then there'll be a sign-in sheet as well. So feel free to stop by. It should take 60 seconds for us to do a quick check to make sure you're doing everything correctly in your cleaning machine. And then you can go on about your day. Thanks and have a great day. Bye-bye.